It's time to finish up heart physiology by talking about a few more homeostatic imbalances. Let's start first with heart failure. Now, don't be confused by this. A lot of people, when they say heart failure, they think, oh, that means the heart has stopped. No, that's not what it means, not at all. People with heart failure are out there walking around, they're going shopping, you're seeing them out on the street. Here's what heart failure means. It used to be known as congestive heart failure, but the American Heart Association doesn't want us to call it that anymore. So watch out, old doctors and old books will call it congestive heart failure. Now it's supposed to be called heart failure. It does not mean that the heart stops beating. Don't be fooled by that. This is a progressive condition in which the cardiac output is so low that blood circulation is inadequate to meet tissue needs. So heart failure actually is a measure of cardiac output. All right, it's a condition of cardiac output. It means that your heart is not pumping sufficient blood to your tissues, all right? And of course, that's a problem. If tissues are not getting sufficient blood, then they're not working correctly. It can be caused by lots of things. So coronary atherosclerosis, those are those plaques that build up in your coronary arteries. Under those conditions, the heart may not be able to pump as much blood as it should. It's just not getting enough oxygen to do its job. Persistent high blood pressure can do this. It puts such a strain. Persistent high blood pressure can weaken the heart over time, cardiomyopathy, and the heart doesn't pump enough blood. Multiple myocardial infarcts, so people who've had multiple heart attacks often, their heart is now so weak that it can't pump sufficient blood. So, see, lots of different things. Now, what happens if we have left side heart failure? So what can happen here? Remember, the heart is two side-by-side pumps. Well, each pump can fail on its own. All right, both don't have to fail at the same time. In fact, they usually don't. One side fails and the other still is okay. Let's think about what would happen if the left side of your heart is not pumping enough blood. Where is the left side of your heart pumping blood to? It's pumping blood to your body, right? All right, so it's the left side that's pumping the blood. If it can't pump enough blood, that means the blood is going to back up, all right? It can't get all the blood out. It's too weak. Well, where is blood coming from that's going to the left side of the heart? That blood is coming from the lungs, right? So if blood starts to back up in the left side of the heart, where is it going to back up next? Next, it's going to back up in the lungs. So blood backs up into the left atrium, then into the pulmonary veins, and then finally into the lungs. And this results in a condition called pulmonary edema. What happens is when blood backs up into the lungs, see, water leaks out of the blood, all right? That's whenever blood goes to any part of your body, the idea of blood is to let nutrients out. And when you let nutrients out, you let water out. So wherever blood goes, water comes out. Your lymphatic system normally will pick that up. But in this case, if blood is backing up into your lungs, then water is going to leak out. What happens in pulmonary edema? This is not a happy situation. It means basically you may end up drowning in your own fluid. Your lungs basically fill with water, all right? So that's left side heart failure. Right side heart failure, let's think it through again. The right side of your heart's pumping blood to the lungs, right? Well, if it can't pump enough blood, then it's going to back up. It's going to back up from the right ventricle into the right atrium. And where was it coming from? It was coming from your body. So now blood is going to back up in your body. Now, because of gravity, where is all that blood mostly going to go? It's going to get pulled down into your lower extremities. So blood backs up into the right atrium and then into the vena cava, then into the body. We have peripheral edema. And again, because of gravity, you're going to see it mostly in the lower extremities. Have you seen the people that have cankles, as they call them? Where their ankles are as wide as their calves. Sometimes you see those people like pulling an oxygen cart around. These days, they got little backpacks with oxygen. They got oxygen tubes going into their nose. They got ankles as thick as their calves. A lot of those people, now there are lots of reasons for that, but some of those people at least might be right side heart failure. Not uncommon at all. So just make sure you get that straight in your head. Left side heart failure leads to pulmonary edema. Right side heart failure leads to peripheral edema. It's kind of backwards from what some people would think. So think it through, make sure you get it straight, all right? Nice little diagram to show you, all right? Left side heart failure, right side heart failure. Left side heart failure, blood backs up in the lungs. Right side heart failure, blood backs up in the body. Let's talk about some developmental aspects of the heart. Fetal heart structures that bypass pulmonary circulation. So the foramen ovale connects the two atria. So in the fetus, think about it. The fetus is not breathing for itself. It's not exposed to the outside world. Mom is breathing for it. So the fetus doesn't really need to send blood to its lungs to get the blood oxygenated. The lungs are not oxygenating blood. The lungs aren't taking in air. So at this point, the foramen ovale connects the two atria. It's a hole, foramen, ovale, oval. It's an oval hole in the atrial septum that allows the two atria to communicate, because basically all the blood is oxygenated because it's coming from mom. So there's no need to send it to the lungs. We can send it to the body, okay? After birth, that closes and becomes the fossa ovalis, all right? Now, it closes at birth but continues to seal gradually for 2 years or more. What can happen, though, is sometimes it doesn't close up properly, and you end up with a patent foramen ovale that allows blood to continue to move back and forth between the two atria. That's what you're seeing in the top illustration. Well, that's not good, because now what that means is you're going to end up pumping deoxygenated blood to your body. This is a condition. Have you heard about babies that when they say the baby is born with a hole in its heart? This is one of those possibilities. If the foramen ovale doesn't close up and to become the fossa ovalis, then that baby's got a hole in its heart. It may be pumping deoxygenated blood to its tissues, and this is one of the reasons babies can turn blue. That's why when you see a newborn baby turning blue, that's when all the alarms go off and people start sprinting down the hallways. You're going to have to do heart surgery on that baby, okay? Then there's also the ductus arteriosus that connects the pulmonary trunk and the aorta. Once again, for the very same reasons. The fetus, it's not breathing outside air. Therefore, there's no reason to send blood to the lungs to get oxygenated, because the lungs don't have any oxygen. So we make a connection, once again, between the aorta and the pulmonary trunk. That's called the ductus arteriosus. Well, after birth, that's supposed to close up to become the ligamentum arteriosum. But every once in a while, it usually closes within about 3 weeks of birth. Every once in a while, it doesn't close, and here's another of these sort of hole in the heart scenarios. Now, that newborn baby may be pumping deoxygenated blood to the tissues, and once again, they're going to turn blue, and this is a crisis, okay? So, congenital heart defects are present at birth. Congenital means present at birth. They allow mixing of systemic and pulmonary blood, and they involve narrowed valves or vessels that increase the workload of the heart. So in some cases, the aorta isn't wide enough, and it can't allow enough blood to flow through. So there are lots of these kinds of different problems that can show up. You can see A, ventricular septal defect. That's where there's a hole in the interventricular septum. That would be another hole in the heart scenario. B, coarctation of the aorta. The aorta is too narrow. And then the Tetralogy of Fallot, which is the next slide. Tetralogy of Fallot, tetra means four. Fallot was some medical dude, I guess. I don't remember. I've read about it and I've just forgotten. These are a collection. They're prominent congenital heart births, conditions, 1 in 2,000 births roughly. There are 4 heart defects that often occur together for various reasons just in the development of the heart. If you get one, you're more likely to have the others. They don't necessarily all 4 have to happen once. You may get 2 of them or 3 of them or 4 of them. But these are defects that occur together, and so they go under the kind of umbrella term of Tetralogy of Fallot. So a ventral septal defect, that's where there's a hole in the septum of the ventricles. Stenosis of the pulmonary valve and pulmonary trunk. Right ventricle hypertrophy. This is where the right ventricle works too hard and gets thicker. It gets abnormally thick. Blood from both ventricles enters the aorta. All right. So signs and symptoms of the Tetralogy of Fallot: babies turn blue, they become limp, they're not getting enough oxygen to make ATP. They can't really do a muscle contraction correctly, have difficulty breathing. They can lose consciousness. And what do? Well, basically, you have to repair those defects with open heart surgery. That baby needs surgery right away. Back in the old days, babies just died. There wasn't anything they could do. Now they can do open heart surgery. I know the late night talk show host, which one was it? Jimmy Kimmel, I guess. His baby was born with Tetralogy of Fallot, and he had all the doctors on who diagnosed and treated his baby and stuff. Very emotional, but it happens. Risk factors: alcohol use by the mother, diabetes in the mother, rubella during pregnancy. Get vaccinated, everybody, okay? And a lot of the causes not really fully understood. I mean, they're just, we just don't understand everything. So, okay, which of the following statements is false? SV is the volume of blood pumped out of the ventricle with each beat. B, increasing afterload increases SV. C, calcium blockers are both negative inotropes and negative chronotropes. D, preload equals EDV. E, right side congestive heart failure leads to peripheral edema. I originally made this PowerPoint back when they were still calling it congenital heart failure. I should change that just to heart failure. Once again, this is how well you have to know this stuff. I'm going to ask questions like this on quizzes and exams. You really need to know this stuff thoroughly. So which one? Yeah, afterload decreases stroke volume. Afterload is the pressure against the semilunar valves that makes it harder to pump blood out. Therefore, they decrease stroke volume. Let's then finish up by talking about cardiovascular disease. CVD, cardiovascular disease, is a huge umbrella category. There are lots of different kinds of cardiovascular disease, and they include things like hypertension, HTN. These are all the cool medical abbreviations. All the cool kids use these, so you better know these if you want to be one of the cool kids, okay? HTN, hypertension. CVA, stroke, used to be called a cerebrovascular accident, and I think we're not supposed to call it that anymore. I don't remember why exactly. I think now you're supposed to call it stroke. HF, heart failure. CAD is coronary artery disease. This is where atherosclerotic plaques clog up the coronary arteries. MI, myocardial infarction, and then any of the various congenital heart diseases. So these are all examples of cardiovascular disease. Cardiovascular, cardio-heart, vascular vessels. These are disorders of the heart and major blood vessels, okay? Cardiovascular disease is the number one cause of the death in the United States since 1900. Cancer is catching up. I think CVD kills around 650,000 a year, and cancer now is up to almost 600,000, I think. But it's still number one. 1 in 4 deaths is due to cardiovascular disease. And coronary artery disease, there you can see that in the upper right. That's where you get a blockage, and in the lower right as well, you get a blockage of the coronary arteries. They can't pump blood. Remember, that leads to angina pectoris and ultimately to myocardial infarction. So coronary artery disease, heart muscle receiving insufficient blood supply, that's called ischemia. You're not getting enough blood. Narrowing of the vessels, artery spasm, clot in the artery, atherosclerosis, they can all cause that. Atherosclerosis means that the smooth muscle and fatty deposits in walls of the artery. So there in the lower diagram you see you've got this atherosclerotic plaque, they're called, and it's blocking the artery. And on the right-hand side you see there is an artery that's supposed to be a big giant oval opening, but look at the plaques that are now blocking the opening. Those plaques will grow over time, and the amount of blood that gets through becomes less and less and less and less until finally, you start getting angina, and the next thing you know, it completely closes up, and you have a myocardial infarction. What are the risk factors for coronary artery disease? Lots of them, and a lot of them are lifestyle choices. High blood pressure, hypertension, which can be controlled by lifestyle and by drugs. Smoking, dyslipidemia, that's abnormal fat levels in the blood. Diabetes mellitus, obesity, sedentary lifestyle, low daily fruit and vegetable intake, alcohol overconsumption, the type A personality people who live under too much stress, family history, if your grandparents and parents had it, you're more likely. Males are more likely, and the older you get, the more likely this is to happen. So there you see, look at the coronary artery disease map of the U.S. Look at where it's highest. All those places where they like biscuits and gravy. Biscuits and gravy. You might as well just pour it into your arteries, kids. And to try to explain what's going on, it has to do with, you've heard all the bad stuff about cholesterol. There are lots of factors here, but one factor can be, so over there on number 1, LDL, that's the so-called bad cholesterol, that's low-density lipoprotein. What happens is, if you have too much of it in your blood, it can get trapped in the wall of a blood vessel, in the vascular endothelium. What happens then is that monocytes come, because that's not supposed to be there, the LDL is not supposed to be there, monocytes come and try to gobble it up. They turn into macrophages, and then they can basically sort of get stuck. They turn into these things called foam cells, and they actually then form the atherosclerotic plaque. So, see, it's a complicated issue, but it can relate to high levels of the low-density lipoprotein in your blood. Hey girl, blood is red, cyanosis is blue. I get tachycardia when I think of you. Ooh, look, it's Ryan Gosling. If you said that to me, I'd kick him in the balls. Okay, kids, we're going to start on blood pressure next. Blood flow, blood pressure.